initiative of the School of Medicine of the Federal University of Rio Grande do Sul, the Hospital de Clínicas de Porto Alegre was founded in 1943, when the first brick was laid, and then took several decades to be completed. In 1970, as a result of a law sanctioned by the National Congress, the hospital became a public enterprise under the supervision of the Ministry of Education, having its own patrimony and administrative autonomy. This legal personality allows the institution more flexibility to work out its objectives and to find the means to accomplish them. To care for thousands of patients that come here every day, the General Hospital needs to be efficiently organised. As part of the unitary health system, care provided is free and generalised. Patients come from Porto Alegre, from the countryside, from other states, and even from neighbouring countries such as Argentina, Uruguay and Paraguay. The hospital has more than 700 beds and 106 clinics for outpatients. It is linked to the life of this city and its inhabitants. To people who see it from a distance, the building seems huge. To those who know it inside, it seems complex. However, to those who come every day looking for medical care, the General Hospital has the capability to meet their needs. The Hospital de Clínicas de Porto Alegre is a hospital of excellence and serves as a national example. The quality of its services is explained by three factors. 1. Being a teaching hospital, it is the most important health research and health educational centre of southern Brazil. 2. It is a modern enterprise with the agility to manage its own resources in order to buy technology. 3. As a hospital of multiple care, it develops programs addressing the community. Through the qualification of its human resources and its modern technology, the General Hospital is prepared to care for simple and daily complaints, as well as serious illnesses, and to provide sophisticated treatment. In fact, the Hospital de Clínicas de Porto Alegre reached an excellent technical level, obtained with federal resources of its own. However, in order to maintain its quality, we cannot relax our efforts. Even if this hospital is good compared to others, there is still a lot to do, bearing in mind its future goals. Because of its present status and new resources, the hospital stands as one of the 4 best hospitals in Brazil, with an important difference: it will have the highest rate of generalized care. The integration of education, research, technology and social concern makes the Hospital de Clínicas de Porto Alegre a leader in the hospital sector in Latin America. The hospital has almost 90 square meters of gross floor area. There are 14 floors with hundreds of specialized sectors, from the emergency department on the ground floor to the surgery unit on the last floor. We find an intricate system that supports and integrates all sectors. The laboratory area has state-of-the-art equipment that performs routine exams as well as sophisticated tests such as histocompatibility for transplants. All previous and essential tests for transplants in southern Brazil are made here. The inpatient wards, located on 9 floors, are divided up into small units in order to make specialized care easier. Few Brazilian hospitals have similar potential. For private inpatients, the General Hospital offers accommodation as good as the best private hospitals, so patients with higher income generate alternative resources to support the hospital and the purchase of up-to-date equipment, with a subsequent impact on the generalized care of the population in our wards. The development of new technologies allows growing intervention in some sectors of medicine. Many illnesses previously diagnosed and treated by surgery can now be approached by safer and faster procedures. When surgery is the best conduct, the General Hospital offers one of the best equipped surgery units in Brazil. Every day, professionals of all areas perform a great number of surgeries of different levels of complexity. The hospital is well aware of the price of technology. Local or imported, it is always expensive. This is why one of its priorities is to develop research in order to design and to build its own equipment. Daring programs are being carried out. For example, the electronic ear, a device that can restore a world of sounds to the seriously hearing impaired, is an example of highly developed biomedic technology. The integration of the General Hospital with education exists since it was created. Professors and students of all health areas are permanently active. Clinical sessions, conferences, meetings and congresses are part of the daily life of the hospital. There are 5 lecture halls and many classrooms. The dissemination of medical knowledge and the daily contact of students with the best professionals of the state is a trademark of the Hospital de Clínicas de Porto Alegre. The patients profit receiving specialized care and the community receiving new and qualified health professionals every year. More than a building full of beds and medical equipment, the hospital is a group of highly specialized professionals that should be fully fit for their work. So the development of its employees is demanded. The School of Auxiliary Nurses and the Hospital High School, open to the community, adds weight to this idea. Besides the traditional disciplines, high school students receive notions on healthcare and specific training at the hospital. Also, the nursery receives preschool children, allowing their mothers to work more peacefully. People that have never entered the hospital can profit from its actions. The multiple attention concept is practiced in various ways. Agreements with official or private institutions bring the hospital closer to the community and broaden its action. Even discharged inpatients can continue to receive support and important information through community meetings in the hospital. Pediatric inpatients have, through the program of pedagogical support, the possibility to continue their normal activities. It is not easy to administrate the Hospital de Clínicas de Porto Alegre. To deal with the large amount of daily information, the computer room has a large capacity computer with 270 terminals scattered through the building. Their professionals develop programs that are of international interest in the area of health information. Hospital administration is very complex. The management of the hospital is as modern as its equipment. In order to work as a real team, the management is in direct contact with the key departments. This way, the patient and the employee have their problems addressed faster. Besides which, the administration can have its own aims efficiently met. It believes its work has a social objective, and it can only be met with regular investment in a constant search for the best technology. The quality of its services is directly linked to the support and trust of the community. Its juridical personality allows the government and other institutions to be associated to a sole idea that health for everyone, regardless of their social class, is a precious gift that must be preserved.